guys, it's Hina Chef here at Rebalance PT, and today on Ask Hina, I wanted to talk to you about a client who called the other day complaining of incontinence, pain with intercourse, left hip pain, and left head and neck pain. And her question to me was, hey, I've gone around, I've seen a bunch of different doctors for my left hip pain and my left neck pain, and I haven't gotten many answers. I feel like they're connected, but I'm not really sure. And could this also be interconnected with the pelvic floor symptoms that I'm having of incontinence and pain with intercourse? Now, I just happened to be giving a talk to a group of people, and she was part of it, and she said, hey, all of these things kind of rung a bell with me. Could this be happening to me as well? So the more I got of her history, I've come to find out that she's had multiple children, kind of talked to her about when her hip pain started and when her neck pain started. And it was kind of coming around the same time during her pregnancy. And then her neck pain started developing afterwards. So I thought I'd share this with you because this could ring a bell with some of you guys out there. Now, this is the pelvis, right? And I have another video that explains exactly what this model is all about, but just really quickly, here's the pelvis, your pelvic floor is inside, and it connects from the pubic bone to the tailbone, kind of like a hammock. Now, this woman has had a couple of births, right? So obviously there's going to be some trauma to the pelvic floor. Now, trauma, most people think, oh, there's a lot of stretching that goes on here. So if we think of the pelvic floor like a hammock, that hammock is actually sagging and it's not being supportive to the organs inside, which one of them is the bladder. So that is perhaps contributing to the incontinence. And I think that could be correct. But the pelvic floor is made of several different muscles. And some of that hammock, okay, some of those muscles could be weak, but some of them could be really tight, okay? Just because you had a baby doesn't mean all the pelvic floor muscles are definitely weak. But a tight muscle, okay, if you imagine, if there's a lot of tightness here, it's also going to be uncomfortable if there's anything going into the pelvic floor. So if there's penetration, such as what happens during intercourse, those tight muscles could actually be painful in creating the pain with the intercourse. But now here's the thing. How does this connect with the hip pain? Well, the pelvic floor actually has a few of the muscles that connect to the hip, okay? So it comes out through here and attaches to the hip bone. You actually can't see the bone here, but here's where it would be, and you can see this muscle connects onto it. So if there's something going on with the pelvic floor, it could be affecting the hip. Now, this woman has also had several pregnancies, so obviously there's probably going to be a lot of postural changes that happen in compensation during those 9 months that she's had children. So let's just imagine if this pelvis was elevated, okay, and lifted up on the left side, okay, so I'm going to demonstrate on me. But say if this pelvis is actually hiked up on this side, and again, I'm exaggerating this, okay? Can you see that my body now is kind of bent over to the left side? Okay, now, we all have to be able to see straight. So what's going to happen to my neck? It's actually going to side bend to the other side. Now, that doesn't make me feel so great because now I'm feeling pulling on this side of the neck and I'm feeling tightness on this side of the neck. So this could be potentially what's going on with this lady. And you walk around this way for days, maybe weeks, months, years, okay, and then you add all the demands of all the things you have to do on a day-to-day basis, especially once you have children, carrying car seats, lifting babies, giving them baths, all those sorts of things, that can just re-emphasize strain in these areas that aren't functioning that well, creating to more pain and irritation. So as far as treatment-wise, now, this lady, said that she's had a little bit of chiropractic treatment, which may have helped. She does see a massage therapist once in a while, and that kind of helps. But nothing has really completely, addressed the whole entire issue. And this is what we're going to be doing with her, is kind of looking at all these areas, seeing which muscles are involved, seeing where there's fascial tightness, okay? Seeing now where the joints might be affected, because it might not just be the muscles and the fascia, but now the joints, if this has been hanging on for a long period of time, could be affected. And then the other thing that can be affected is the muscles that attach to these joints might not be working right, okay? Your body is, kind of works like a great orchestra and symphony in order to produce that movement. they all have to be working in conjunction with each other. And if they've kind of been handicapped in like a funky position for a long period of time, they're probably not going to be doing what they need to do the right way. And so you have to re-educate them once you address the body with, you know, hands-on work and tissue work and joint work, to now say, okay, now we need the muscles to actually do what they are supposed to do. So anyway, so that's how I think we're going to be attacking this lady when she comes in. But if you are watching this video, I'm thinking this might ring a bell with some of you guys. So if this is something that feels like it connects with you or resonates with you, and you haven't, I guess, seen the right provider to do these things for you, then you might want to seek out a physical therapist that knows how to treat holistically and in an integrated way, and knows how to potentially work on the pelvic floor, and they can hopefully string all of this together for you. Now, if you live in the Philadelphia area or the surrounding suburbs, then give us a call. Go to our website. It's rebalancept.com. And you can be eligible for a free consultation, either in person or on the phone, where we can kind of see if you know, that all of these things could be connected or not, or what the next steps would be, and we can get you evaluated and treated and on your way to functioning much better. So I hope this video was helpful, and have a wonderful day.